Hello, thanks for joining us on platform on the network service of the NTA. I'm Ruth Aguele. Who counts as a senior citizen? Well, according to the Nigeria Bureau of Statistics, a survey carried out shows that about 14.9 million Nigerians are aged 60 years and above. And the numbers we hear will keep increasing because people grow old every day. An aging population, experts say, poses numerous social and economic challenges, but with the right set of policies, it can equip a society to address these challenges in due time. The national policy on aging established by the federal government is expected to change the narrative for the nation. The National Senior Citizen Center is already designing a roadmap that would strategically enhance livelihoods of older persons in the country, from healthcare, social programs, entrepreneurship, work schemes, educational and living opportunities, among others, which is what the Act provides actually. The conversation on issues around aging has come to stay in Nigeria. But what is more significant, especially for Nigerians who are eager for a quick response to the challenges older persons face in the country, is when will these benefits, start manifesting? How does the center intend to carry out its mandate efficiently and effectively? How will the national policy on aging be a working document and not just a sitting document? Economic development opportunities for senior citizens in Nigeria is our focus on platform, and our guest is Dr. Omokaro, Director General, National Senior Citizens Center. Once again, you're welcome to platform. This is your second time on platform, right?
Yes, after my
we just had to call you back.
Thank you.
There's so many issues after our last conversation.
Yes, indeed.
Okay,
Thank you.
Let's take you through a bit of her profile. Dr. Omokaro holds a PhD in development sociology and postdoctoral certificate in social gerontology, University of Calabar, Nigeria, and International Institute on Aging, UN, Malta. Dr. Omokaro leads national, continental, and global advocacy for older persons' rights and aging mainstreaming in development agendas, and drives the professional training of policy and decision making in government and private institutions in all aspects of aging in Nigeria, and we're here also in countries in sub-Saharan Africa. Dr. Omokaro has served variously as a visiting and also a lead scholar at the National Universities Commission, as focal person for development of benchmark statements and minimum academic standards in PDG, MSc and PhD studies in gerontology, and enhancement of capacities of academic staff in 11 Nigerian universities to obtain the specialist in aging certificates in collaboration with University of North Texas, Denton, USA. Dr. Omokaro is an editor, INA Journal of Aging in Developing Countries, and guest editor, special edition on aging in Africa. She has published many academic articles. A woman of different sides, as long as it has to do with helping people age gracefully. Just contact Dr. Omokaro. Her profile is more than that, actually. That's just a quarter of it.
Thank you so much.
Okay, we have a panelist as usual on platform. Please help us welcome Hadiza Onido. She's a reporter with 21st Century Chronicle newspaper. Thank you, Hadiza, for joining us on platform.
Thank you for having me.
All right.
Welcome.
Thank you. Good to meet you.
My pleasure.
So, we have about 14.9 million aged people, that's from the age of 60 years and above, and we hear the numbers are increasing. Now, from the last time you were on platform, we looked at a lot of issues concerning the challenges older persons go through, but after that time we've been following your track record, and we've seen that you've set the ball rolling.
Yep.
There's a roadmap.
Yep.
The policy, we want to see it start implementing. There's a whole lot after that period. But
yes.
What is it at stake now for older persons in the country?
The last time, thank you for having me again. I really appreciate NTA because they are helping, to create awareness of the center and then following up on the work that we are doing. We need it very desperately. People need to know us. The last time I was here, I was just telling you that we want to embark on developing a strategy because this is entirely new. like I said, we're not inheriting anything. And so we had an inception meeting and inaugurated a National Technical Working Group. And since then, it's been a lot of progress that we have made. We set out a plan of activities, and apart from developing the roadmap, we now engage stakeholders, because everybody should own this, all the critical stakeholders, and there are 8 critical stakeholders categories. So we set out to engage all of them. We had northern zonal consultations with stakeholders, and then after that we had the southern zonal consultation. And this covered the 17 states in the south, and the north covered the 19 states in the north. And we are talking about a collection of stakeholders in, senior citizens themselves, Association of Older Persons and pension unions. We are talking about MDAs, very relevant ministries and departments and agencies. Also professional bodies, Gerontology Association, geriatrics, social work, nutrition, professional bodies in the very relevant areas in aging. And also private sector. Yeah. Because also we want private sector to be involved, as well as civil society organizations, not only in the field of aging, but in the field of gender and disability. Because of course, some older persons, a good percentage, grow into disability, or have disability, before the age. And then of course, traditional institutions. We have to understand, but this is community-based. Most of what we're going to do is going to be community-based. Traditional institutions as well. So the 8 categories, both in the northern, zonal, a consultation, and the southern zonal consultation. Why did we do this? Because we wanted to hear from them, and because we want ownership, we want inclusion, and we want participation. Yes. And then, of course, we needed them to identify the challenges. And not only to identify the challenges, because this is a strategic document, we needed them to also tell us how they think this can be achieved.
It's a 10 years
strategy,
10-year strategy
that we are developing.
10 years.
Yes. Why? Because,
why? That's what I was going to ask.
Yes. Why? Because this is very new in Nigeria.
Okay.
And because it is a start of something very new, we want to be able to see ahead. And the strategy helps you to look at the issues as they are, and from the issues identify what should be the priority and what should be the approach. And then now, what capacities do you need? And the National Senior Citizen Center is very peculiar. Peculiar in the sense that it does not own these statutory mandates. For instance, health. It does not own health. Health sits in the Federal Ministry of Health, and also with the National Primary Healthcare Sector. So when now health is identified, that's one of those things we should do, we have to now sit down to look at partnership capacity. What does that translate into? This is really strategic thinking. So what challenges would you meet, and how would you go around those challenges? And what human resource capacity do you need? What kind of technical partnerships would you need? And now you're new, and your constituents, older persons, are in the rural and the remote areas. And then you only have right now, as we sit here, just one office in the headquarters of Abuja. But Abuja is not where you're supposed to be focused. So that's critical thinking now. How do you now start off, reaching older persons? So now you now have to look at all the very relevant MDAs with the statutory mandates that fall into your own domain, and now begin to structure partnerships that will translate into sustainable implementation capacity. Yes. So it's a lot of thinking. And not only that, because these MDAs have the statutory mandates that speak to the entire nation and all population categories, you now have to deal with them and then build capacity and bring them into the context of aging. Okay, we are talking about primary healthcare, for instance. And of course, we have primary healthcare centers. About 40,000 have come to know, are scattered all over Nigeria. And yet, we cannot really speak about inclusivity of the geriatric concern. So now we are sitting, as I'm talking to you right now, there's a technical working group between the NSCC and the primary healthcare center, because we want to start to look critically into that nucleus. Let us begin to build it before we invite other stakeholders in. And I'm very happy to say that WHO is supporting this.
Okay.
So we have WHO. So strategy is very important. And when we say 10, we are also looking at the theory of change. We are looking forward and then trying to track it back. What could possibly go wrong? So 10 years is to say we are thinking sustainability. We are thinking direction, priority, building capacity. And a bit ambitious, yes, but we've never had anything about aging in Nigeria, any systems.
Indeed.
So we are thinking in all directions and trying to be innovative and bringing in all the stakeholders.
Okay,
so
let me
yes.
allow Hadiza to come in now. Go ahead.
Yes, ma'am. This is the first time that we are having this. Quite commendable. But what is the particular concern that brought this to the fore? And why now?
Oh, yeah, that's a good question. So what brought this to the fore? I can tell you 1,001 reasons why this came to the fore. Number one, the rights of older senior citizens. The rights of senior citizens. They are bona fide citizens of Nigeria, and the Constitution gives them the rights to be included in any development plan. And for a long time, they were out. And secondly, is that is a reservoir. That is a population category that has economic value, whether it is when their capacities are enhanced for them to continue to engage, or even towards, the end of life, or at a point when their functional capacities decline and they need services. So whether you are looking at them as engaging or you are looking at them as recipients of services, they all have economic benefits. So now Nigeria is sitting now in a place with the policy and the act to be able to harness this in whichever way it goes. So if you're talking about economic development, investment opportunities, employment creation opportunities, this is the season.
Okay, in your mission statement, you aim to promote investment opportunities through the National Senior Citizen Center.
Yeah.
How?
Yes.
Investment opportunities.
First and foremost, before we do that, how we are going to do that? You ask me how.
How?
It's first to reorient Nigerians. Not to look at this population category as people that are welfare recipients. Not to look at older persons as people that are spent. They have nothing to contribute. They are a burden. They are consumers. Very wrong. And any country who sees the population, this category of population, we just said 11.9 million, like that. And when you talk about, and then you look back and say, who are these people? Most of them are retirees.
Yes.
People who have invested themselves in learning. Experts, whether they are in the formal sector or the informal sector. And the informal sector, they are still engaging. Statistics has it that 70% of those 60 years to 65 are still engaging, 70%. And then 50% of those from 65 to 75 are still engaging.
Yeah, some of them are even top entrepreneurs.
Yes, top entrepreneurs.
Yes.
And now their latent assets, their potentials are there. So a country that positions now as Nigeria is positioning, with a policy and with the act, a legal framework now. So if we now sit down and look at this population category as, yes, these are assets. And then we are innovative in designing programs like the National Senior Citizen now is designing. Just give us 5 years and you will see the geriatric market that is going to grow. It affect insurance, it will affect pharmaceutical products, it's going to affect intergenerational linkages, life coaches, it's going to affect like the senior centers we are going to build. You are going to see a synergy that is going to empower not only the youth, it's going to bring create vibrant communities, social enterprises in communities. Why? Because most of these older persons have for a long time been neglected in the community. And whereas they are still engaging in their subsistence, livelihood endeavors. So just inject some capital. bring in some modernity, incentivize the youths to be part of that.
Yes.
And then you begin to see a vibrant community.
Majority of these older persons, you find them in the rural areas.
Yes.
Now, what you're planning is fantastic.
Yes.
In terms of the benefits, older persons, when we're talking system, changing the system, changing the narrative for those benefits, accessibility is key.
Yep.
What's your strategy in ensuring that these older persons in the rural communities get access to these benefits?
I think I mentioned that most of the things we're going to do is going to be community-based. That is why I told that it was very critical for us to now sit down to look at what our opportunities are and what our weaknesses would be. And the opportunities we have is that we already have MDAs that have these mandates, although the mandate pertains to all the population categories. So now with NSCC, now position as one, a coordinating agency, two, a collaborating agency, three, an initiating agency, four, a lobbying agency. So now, in entering into very critical strategic partnerships, for instance, I just mentioned National Primary Healthcare. Primary Healthcare, the Primary Healthcare Development Agency has over 40,000 primary care centers. And before now, these primary care centers, yes, they tried, but they were tilted to mother and child. And now, I just told you that now there's a technical working group that we are going to begin to look at, mainstreaming geriatric care into primary health care. Not just mainstreaming geriatric care into primary health care, but training community healthcare workers and opening up all those wards. And then building and training to be able to give support services, not only to those older persons who can get to the center, but all those older persons who cannot get to the centers. And we're also looking at, collaboration, partnership with the local governments, because the local government is very key.
Yes.
And so there are many programs that we have mapped out, and the many programs are sitting as statutory mandates of other, of other agencies. And we are bringing all together, sometimes not just, bilateral, but you have multi, because this is multi-sectoral. For instance, where we are developing a program on elder abuse prevention, elder abuse, rescue, remedy, reporting, and provision of legal services. Apart from, education, sensitization, and all that, NSCC cannot do it alone, like you have said. We don't have the reach, at least not now. But we have the National Human Rights Commission. Yes. And we have talked with them. As a matter of, we have already developed a technical working group. And with the Human Rights Commission, now is the legal.
I was going to mention legal aid council.
Yes, oh no, yes. We already have a technical working group. And now the community, and we are going to bring the local government when we are running our pilot, and then we are going to bring community members, because whoever belongs to that squad has to be somebody that the community will have full confidence in and trust. Even law enforcement agencies have to be part of that. So you can see that in critically thinking, in strategy, it takes us back to our strategy. Before we even talk about implementation, you have to see very clear the kinds of capacities you need to develop, the kinds of structures you need, the kinds of human resource you need to build. And of course, where will the funding come from? All these are strategic thinking. How are you going to prioritize it? What are those things that are threatening you? What are those things that are your weakness? Exactly. Okay. So that is what we have been doing now critically as we are developing the strategy. We are running on so many tracks because older persons, like you say, have been on the border for so long, waiting.
And a lot of Nigerians have asked, some people, this is just new to them.
Yes.
Okay, we have a senior citizen center for the older persons. What exactly, if I have an old person in my home, or, the older persons in Nigeria, what exactly are they going to be benefiting? Who are the beneficiaries? Yes. How are they going to be selected? You have your domains, which cuts across almost eight.
Yes.
Benefits for these older persons. How is that going to be done?
Now, there's no one typical older person, like I tell you. Nobody, all the population is not homogeneous. So as you have many variety, different kinds of older persons, so also you have different challenges. There are some challenges that pertain to all of them. Health, for instance. Health, for instance. And so when we talk about health, how do we make older persons to benefit from health? So you have the health domain, health and well-being. So what should we think about? What should we deliver? First and foremost, it has to be that we start from the primary care, because we have 3 tiers of healthcare. So how do we make our primary healthcare? Don't forget, it's not our statutory mandate. It is with national primary healthcare. But we are working with primary healthcare to point out and to do whatever we need to do. Training, training, working with them to mainstream, providing support services to ensure that a time is coming, and very soon, where every primary healthcare that you see in this country, no matter how rural, if you go there, there's geriatric assessments. There are people trained in geriatric care. There are people trained, social workers, that in that community that know how to, do case management. That old woman is there, cannot come here. So how do we get help to that whole old woman? So first and foremost, look at it nationally. All the national systems and mechanisms that are available, that before now excluded older persons because their services were not aging specific.
Yes.
So now with the Senior Citizen Center, it is our place, that's our mandate, to ensure that whatever you do in aging, in primary healthcare, that is why I say we collaborate, we coordinate, we lobby, we initiate, to ensure that that older person there in that rural community can walk into a primary healthcare center and then be treated as a child will go and be treated as a baby. And we need to train, we need to build the infrastructure, but we do it together and all the stakeholders. So if you take that, and then you now move from there, and then you talk about health insurance. So how do they get the cover? So what has been happening now is that once you retire, you fall off. You're no longer covered. But even before the National Senior Citizen Center was established, there is a ministerial committee that the mandate was to look into, health insurance coverage for retirees and for older persons. And we have been working on that. And so now it is, so what constitutes the basic healthcare package? Before it was anything that goes for you, goes for an older person. And we say no, because health in the context of aging is a different kind of health in the context of the youth. Yes. So geriatric assessment has come in, so many things that will benefit older persons have come in. The report is about ready now, and then it's now how to get the money. And then again, we want to also look at the products that National Health Insurance has, because we've discovered many products that the local government can key into. It will not cost the local government anything to cover all the older persons in the locality, in the community. So we are looking at how we can bring health insurance to the rural community. It could be community-based health insurance where philanthropists, the local government people, can buy into in a sustainable way. So we are looking at so many innovative things that would benefit older persons.
Okay, Hadiza, you want to ask a question?
We have all sorts of things running through our head right now. We have never seen anything like this. Can you paint a picture of what the center will look like? What we are expecting right now? People are asking questions. People are intrigued.
Okay.
What is the center for a senior citizen going to be like?
Let me clarify something.
Is it a place?
That is confusing for most people.
You know why she asked that question? Because of the domains. You know,
yes.
You have about 8 domains.
I'm coming there. Okay. I'm coming there. But I want to clarify something. Okay, now there is a National Senior Citizen Center with a board. So this is administrative. This is the headquarters in Abuja, indicating that there could be zonal offices. Yeah. That's what the Act says. And this National Senior Citizen Center has a Director General. So this is a body corporate with a board in charge of governance, in charge of, directing the policies and the actions and all. And then the Act also, in lining up all the functions of the center, also says, build senior centers most people will confuse the senior centers with the National Senior Center. So one is a body corporate in charge of this. But one of the functions of the mandate is that now, in identifying the needs and challenges of older persons, one of those needs and challenges you'll find is loneliness, is isolation.
Neglect.
Is also neglect, and is the lack of a place for recreation and sports, healthy living, active aging.
Engagement.
So those are the centers that we have been mandated to build. Okay. And also to encourage, the states also to domesticate these acts and to build these centers. So we will build models. We will design models of these centers after needs assessment. We have to do needs assessment. For instance, the center that might be in the north in some places will not be the center that might be in the south in some places. And the center that will be in the urban center might not necessarily be the kind of center that will be in the rural area. But every place deserves a center. Some will be agency-oriented, which means it will be more of social programming, where they go for their needs, and that. But where they go to enjoy themselves, where they go to, and there's going to be a lot of programs like, upscaling them, training, lifelong opportunities where they can do financial literacy,
Is
care
it going
literacy.
to be free because you're a citizen of Nigeria?
Yeah.
So I can participate as an older person. I can just walk into any of the center and be a participant.
Yes, you can be, like I said, the centers are not going to just have one model. Okay. Some will be voluntary, where maybe you have to pay some token to belong. And some, for instance, we put a center in the rural area, is there to save, people that need social programs, that need, social assistance, that need, to be helped. Also, that some, depending, the senior citizens will determine what they want to do. Yes. But what we are saying is that it's going to be a place where we talk about recreation, it has to be there. We talk about interactions, playing games, it will be there. And we talk about serious issues of intergenerational synergies, learning, digital technology to be able to use their, technology, it will be there. And what the center would do is not to further isolate older people. So we will not build a center and the youths will get up and say, oh, Papa, let me take you to your place, and drops you there and say, oh, when you finish, I'll come and pick you.
Yes, ma, because they were concerned that Nigeria was heading towards building home for older people like you have in Western countries. I'm coming there, you're conflicting two things now. Let me finish. I'm coming there to address your fear. Yeah. So because we don't want, the center to further isolate older people, for them now to be ageism and stereotyping, you're going to the center, they are laughing at you, you're old, you're going to the center. We want to be able to design this center in such a way that it's a hub, where now it becomes a hub for the community there. So we are looking at putting, co-working spaces. We put solar for you there and put internet for you there. I know you're crazy about internet, you go there because you want, and we make that internet use free, but you have to earn your hours. So you go to the center, go and save senior citizens in that center, earn your credits, and then take the credit to the co-working space, and then use the space. So we are thinking innovatively, because our slant is to make it intergenerational, so we don't further isolate older people. And then there will be classes, co-education, intergenerational co-education classes. You teach the older persons and you sit down there and hear their wisdom, because you need life coaching. So these are the centers that we are going to build. Fun places where senior citizens wake up and look forward to going. And they won't stop. You can get your health checked. You can get referrals. And we're looking for where the primary health care is not too far from the center. Or it can't even be within the center. That is why right now we are talking to private sector. We had a private sector roundtable. And in the private sector roundtable that we had, we were able to show them our flagship initiatives. And one of the flagship initiatives was our conception of the centers, where, communications company, any digital company, any company at all, come and,
invest.
Take up, invest, build the center, and then brand it. If you like to paint it yellow, green, just do, but build us the center, and then help us, with whatever digital thing we need, work with us, collaborate with us,
Dr.
and then get the center.
What you're painting for Nigerians right now is huge.
Yes,
it
it is
will
huge.
entail a lot of funding.
Yes, I know.
And we know the challenges the country is already faced with. So what about starting? I'm not saying the plan is not a fantastic idea. If we're looking at a 10 years roadmap, what about now? What is in place? I know documentation, administrative affairs is all going now. What should people begin to benefit from the scratch?
I just told you. Before long, we are going to have geriatric care.
I'm talking about why the wait before, why the wait for the construction of those centers across the country? What should they be benefiting now? Because you and I know those centers are not going to be built in 1, 2, 3 months or 1 year.
I have to say something here. This is an agency of government that has never been. And this is an agency of government that has mandates. And it's also an agency of government that is in a peculiar place because the mandates, the directive that it has, it does not have the sole power to run those mandates. It has to collaborate. It has to train. It has to look for the infrastructure. It has to build on and ride on the mechanisms of those other agencies that are already in existence. It will take a little time, just a little time for us to get it right and get it in a sustainable way. It will be very easy, and of course, and we did that. We had a medical outreach, you are aware, that we went to a local, rural community, a village in FCT here. And it was a very successful medical outreach because all the older persons came out. And that was two-pronged. We went there for 2 reasons. One, yes, we were celebrating International Day of Older Persons, and we know health need is a very critical need, and we needed to reach them at least to bring respite and relief. And 2, we wanted to hear from them because we are very particular about, the challenges and how it affects them. I can sit down and assume, yes, I know they have health challenges, but that would be very, you don't do that. Let them speak for themselves. And and it was also a research for us. And we asked them, so what's the distance between where you stay and the primary healthcare center? How do you get there? And then, should you get there, and this was in their native language, got translations, should you get there and you are referred, and they say, oh, no, you have to go to General Hospital. How do you now get from there? So do you go? How do you get from the primary care center to the General Hospital? Some of them say they don't go. So you see what happens there. And that now increases impairment, disablement. Because what could have taken just a little, doctor, diagnosis and treatment, because they now cannot go, because of the distance, the logistics, transport logistics, cash logistics. So all these things are things you take into consideration. There are so many things you are thinking. Is it so impossible, to have, a mobile medical clinic? Is it so impossible? So there are so many things that we are thinking. And yes, you say, so where are you going to get the money for all this? First and foremost, yes, it is the idea and how you be able to capture it critically, strategically, that now, I said this before, that now you invite the partners. So what we are doing now, apart from our strategy, we also begin now to operationalize. As I told you, we are running on so many different tracks. We are now in that place. Our inception meeting for the operationalization of the policy is 10th, this 10th November. And we already have, technical partners.
Because if the policy is not operational, it can be implemented.
This is what I'm saying. So we have now technical partners. So we are looking at, and we are now, focusing on specifics. We are going to have the whole policy operationalized. But because we've never existed before, we want to be able to design programs. Design the program. We can say, oh, their challenges is health. So let's go give them health. How do we design primary health care now? And we cannot do it alone. So let's sit down, bring national primary health care, get the Federal Ministry of Health, get WHO, get all the stakeholders for us to sit down and say, so what would a functional, inclusive primary health care look like? And how do we get it? How do we get the people to understand geriatrics? How do we get services to that thatched house there? How do we open up to remote areas.
We have dwelt extensively on the health challenges that older people face. Can you talk more to us on other challenges that bedevils them that the agency intends to tackle through the center?
Poverty.
Thank you.
Poverty. So now we are talking about income security.
Yes.
And the way to measure income security for older persons is, first, you look at the pension coverage.
I was just going to mention pension.
You look at the pension coverage, first and foremost, apart from even the administration of the pension. The question will be, how many people are covered?
Even life insurance.
If you talk about 11.9 million older persons, they're not up to 2 million that are covered.
Do they even have life insurance?
We are coming there. Who are covered? If you look at all those who had the opportunity to work in the public sector. And then out of even these ones you say are covered, how many are in the federal? How many belong to the private sector? How many are the states? And how are the states faring? We discovered only very few states. And we know them because we went on stakeholder consultation. And we invited pension boards, deliberately invited state pensions board. Because we want, pension is not our mandate. Because you have pensions acts and you have commissions. But where it concerns us, it bothers us, is when it now bothers on their well-being, on their rights,
deprivation.
People, on deprivation now, that bothers us. So everything is linked. So now,
so what are you working on in that regard?
In this regard?
Yes.
We have a whole unit in our organogram that deals with these matters. How do you help older persons that fall in this category? For instance, now we have, maybe I should mention the states, we have the hybrid model that Jigawa is using, and it's not owing a dime to anybody. And we also have the worst states, name withheld, and we also see what they're doing. So we've been able to borrow this best practice. And we are talking to states, because it looks simple. It was really innovative, critical thinking. So if you go this way, and you learn what this state is doing, something can happen. So it's now a matter of political will, and then we become the advocates. We become those who lobby for them. And at the same time, it is our mandate to now build, provide opportunities for them to generate income. Provide opportunities for them to supplement their income. How do we do that? We help to initiate, help to enhance their capacity. Work with those who are ready. For instance, now in Oyo State, we're talking. And the beauty of what has happened to NSCC is that because we engaged in this stakeholder consultation that covered 90 states in the north, all the people we invited, now we have a platform. So we can stay here. I can stay where I am. I'm talking to Sokoto. I'm talking to Zamfara. Because we're all on the same platform, and these are critical stakeholders.
What about
the same from the south?
Data system management? You can achieve some of this strategic plan you're talking about without effective data system management, because you need data. Okay, who are the pensioners here? Yes. Who are the people that need health care here? If you're going to streamline them, you need data, effective data system management.
Yes, I'm sure you saw that in one of our domains, the data system. And it's also in one of the acts. Should I say, unfortunately, before now, older persons were excluded from most national service. And then before now, it's very difficult to have any data, any disaggregated data on older persons. Most of what you will see are national aggregates. When you see data that is national aggregate, you cannot say who is the 60+ person there. However, for the poor of the poorest, of course, we have NASCO, and they have already delivered data to us. So we have data from NASCO that covers all the states. And these are the ones they already captured, and they're still capturing. So from the data that we have with NASCO, we can look at the states, even down to the local government, and we will be able to tell a local government, we know the older people in your local government, and we know the poor ones. Remember I was telling you about health insurance, how we want to bring in, Algon and discuss health insurance. So it will be very easy, like you said, for us to open the data of the poor people in a certain local government and say, these are the numbers. And we are trying to bring geriatric assessment and health care into the primary health care center there. With so and so amount of money, if you follow, some of the programs of NHIS, you can cover the older people in your state. Some of these things is easier when you break it down. They say that is not a whole lot of, you can do that. And then talking about the data, the system that we need to build. Number one, don't forget the last census that we had in 2006. So a lot of these things have been projection. Now, for the National Living Standards Survey.
But there is one in the pipeline going to happen soon.
Next year. And we can't wait. We're waiting for that so that we can have that and have it disaggregated. However, at the same time, you know that in 2019, NBS, National Bureau of Statistics, they conducted the Nigerian Living Standards Survey and brought it. So that is the most current. So right now we are working with NBS, technically working with NBS to now extract from what they have and disaggregate for us. So from MBS, we are going to have socioeconomic status, living conditions, health conditions, So we are going to be able to have that. Even distance to healthcare, we are going to have that. So we have someone working directly with MBS. Over these months, we have paid courtesy visits to very critical MDs that we consider very critical to us. And yes, it was to felicitate and tell them about the National Senior Citizen Center, but it was very strategic. So we determined what it is, where that intersection comes between their mandate and us. And then we already determined what is it that they can do for us.
Yes.
So those visits, and every single visit we have made has ended in a technical working group where we see the intersections. And then we are now putting the modalities of how we can work together. So that's what we've been able to do.
Okay, Hadiza.
So yes, ma'am. Exclusion of older people have been felt by all. We may not have acknowledged this directly, but most of these people, like you rightly said, have latent capabilities that we allow to quieten down in them as soon as they leave the face of engagement with what they used to do. The center have talked so much about injecting a lot into older people. How do we get back from them?
Oh, so many ways of getting back from older persons.
Especially their experiences, their knowledge, those latent capabilities.
You see, most of the times what you hear is, government. When government wants to do something, government will start, government will not end. You see, the difficulty there is that you have a center like the National Senior Citizen Center, and it's coming to your community because the older persons are your grandparents. So for you to now not be part of what the center is doing and not see the part that you can play in what the center is doing as a member of the community. And we now, I'm saying this generally now, is a message I'm using this platform to send out. And we now fold our hands and say, oh, government is breaking. No, we are all part and parcel. That is why I told critical stakeholders, traditional institutions, private sector, you and I, media, ownership. We are all critical stakeholders. So you asked, how will we get, older persons to release their latent potential? First, stop discrimination. Don't look at them as if they are from outer space, that they are spent and they are ugly and they have nothing. When you appreciate the years of experience, where that older person has come from, whether it's even be in building families, they are the ones who trained everybody. And everybody's grown and gone, and they are there.
Yes.
So the question is, so why is it that when people marry, they just newly marry and they have their baby first time, why do they call their grandmothers? Why do they call their mothers to come? Because they know that their grandmothers have something to give because of experience. But you see, that kind of work is not repaid, it's not rewarded, it's not even counted as work.
They see it as culture.
Okay, they see it as culture and they abuse. So I had to take you there to know that even where you are, older persons are still releasing value. So then the question, let's leave that level and now go to the community level. You will find out that in your community, you see that old man and that old woman who had been farming, subsistence farming, That's where they eat from. That's where the family eat from. And then maybe when we have all this agriculture, thank God they just launched a smallholder farmers, enhancement, capacity enhancement. I was so excited. But we have now to push ourselves in there to see what pertains to older persons, because I just kept hearing women, youth, but I don't know whether all the women are there. So these are the initiatives that are already in existence that we see, and we will ensure that aging is mainstreamed and older persons are mainstreamed. And there are also other initiatives that we will create ourselves. Our flag, those are the ones I call flagship. And one of those in entrepreneurship and work scheme is that, first and foremost, we want to empower older persons who are still engaged. That's why we are bringing in the financial institution. Were you there at a round table? Yes, you were there, Ruth. Yes, at a round table. You saw there were financial institutions there, and they were hearing these things for the first time. And even one of those banks said, oh, we have products for older people. And some people say, we never heard.
Just like people...
We never heard.
People have not really heard about gerontology, the study of gerontology, which is not something really common in this part of the world, which is also very critical, whether we like it or not. That's a line we must cross. Old age.
Yes.
We must grow old.
And pray.
Yes, we pray actually to get there. People who are already there, they're already living the life. What about making this awareness really strong, to make people understand that there's a whole lot people need to understand about aging, about the care for the elderly? Yeah. What would you do about that?
First and foremost, this will not be a start, because that's what I used to do.
Yes.
That's what my foundation, when I was, should I say private citizen?
Whichever one you classify yourself.
That's what we used to do, building capacity, advocacy, mainstreaming gerontology in educational curriculum. And we did that for the Nigerian University in collaboration with NUC, mainstreaming into, the university curriculum. So you can have PGD, MAs, MSc, and PhD in gerontology. And now this can also be cascaded down to the secondary school, not really gerontology, but aging, appreciation of old age and, ageism, discrimination, and the expressions of those, and importance of family respect and all that. So now, talking about gerontology, I think with the National Senior Citizen Center, because one of the categories, stakeholder categories that I failed to mention, I forgot, is academia and research. It's one of the serious stakeholder category. Why are they so critical? Because of what you're saying. Academia, how do we mainstream this? In all aspects, whether it's geriatric social work, whether it's, it's just training caregivers. And one of the things that, I'm sure you saw it in one of those domains, is care quality, which we intend to, develop a national curriculum on care, train caregivers, certify, agencies that, oversee, administer caregivers and caregivers themselves. So that apart, NSCC is going to ensure training of caregivers, certification, inspection of, all these facilities, and then work with academia and researcher. First, develop a national research agenda for Nigeria, because that is very necessary. So we don't go here and there. This is what we need. So it will be research that you demand, research on demand. This is what we want to find out, like needs assessment for senior centers. I'm already talking with, these researchers.
A guided
research. A guided research. So now, that's also NSCC would do, to talk to the necessary agencies, NUC is there already, they've taken off. So other agencies, for instance, the care, how do we create a career path for caregivers? So
when you're having a conversation that affects, one important strata of the society, you wouldn't even know when the time is up.
Oh,
time is up. Thank you very much, Dr. Ememo Makaro. I know there's so much. We're still not,
aging is very expensive.
Finding out. There's so much. Aging is something
multi-sectoral, multidisciplinary. Anybody can come into aging. Environment is there, town planning, everything.
She said it all. Thank you very much.
Thank you so
I
much
know
for
your
having
10-year strategic developmental plan is something quite interesting, and we hope to see that sustainable implementation capacity you talked about. Thank you very much for your time.
Thank you for having me.
Hadiza Onido, thank you very much for your time with us on platform.
Thank you for having me.
She's from the 21st Century Chronicle newspaper. Thank you very much. Okay, we've been discussing economic opportunities development for senior citizens in Nigeria. Like Dr. Omokaro has said, it's a multi-dimensional sector. It's something that affects you and I, whether we like it or not. There's a whole lot, and it entails a collaborative effort. It entails commitment from you and I. Let's stop the neglect. Let's stop the deprivation. They are part of us. I'm Ruth Aguele. Thanks for watching Platform.